Hello, bonjour, and welcome to a special Prep Doctors panel discussion. Today we're going to be talking about the National Dental Examination of Clinical Competency, better known as NDECC or NDECC. My name is Uthman Quick. I'm the Marketing and Communications Manager here at Prep Doctors, and I'm delighted to be joined by some of our senior instructors, starting with our co-founder and Chief Learning Officer, Dr. Marwan Al Rayes. Hello, Dr. Marwan.
Hello.
Senior Clinical and Situational Judgment Instructor, Dr. Fakhri. Situational Judgment Instructor, Dr. Alaa Zourob, also a recent DDS graduate of the University of Toronto. Senior Clinical Instructor, Dr. Fersan Marei, and AFK, ACJ, and Clinical Judgment Instructor, Amr El Maghrabi. And on the line from Richmond Hill, we have Dr. Ahmad Judeh, who is our Head of Clinical Skills at the Richmond Hill campus. Let's just get straight into the discussion. And I wanted to start off by asking you, Dr. Marwan, about this exam in general, if you can basically summarize it, and then also talk about what we've done here at Prep Doctors in order to prepare dentists for this exam.
Okay, so I'll give a quick overview and then I'll let, because everybody had a role in this course. So this exam actually was announced in the early phase of COVID as an idea that this is gonna take place. Of course, any new unknown exam to candidates carries with it a lot of stress. So that's something that we have to acknowledge. People went through tough times because they were used to a system. Now there's a new system that has been implemented. And also an anxiety associated with the unknown was building up because the information regarding this exam was released bit by bit. So people were always waiting for an update from the NDEB side, just in order to start preparing to know where things are going forward, because the news came that there's gonna be a new structure, a new exam, and there's unlimited attempts. So there's positives that were announced, but at the same time, the structure of the exam was not clear from the beginning. And of course, people, they come back to us, they say, how are you guys gonna prepare us for this? So at the same time, we're also sitting, waiting for news because we have to start the development of material. And with the short notices and the update of information, the team was working more than full speed to bring things up to the required time that people have to prepare for the exam. This exam, in simple, back in the days, it used to be just a clinical skills, so it was a hands-on exam. This is still a skills exam. The name is a bit deceiving. I always tell people it's deceiving. They call it situational judgment, but it's actually not situational judgment. If you want to look deep into the type of exam, it's a communication skill exam. So it's where you have to bring all of your knowledge that you have studied for in AFK and ACJ, whatever you have covered before, and you have to apply it now. So it has a component that is new. It's built in a way similar to the way pharmacy have their board exam at the end. It's the stations. They have to communicate. So it's a totally new exam. Now, this exam is 10 stations. I don't want to get to the details because people are familiar, so I don't want to bore people with details of the exam. And they actually cut down the hands-on to 1 day. So now there's 1 day skills, the practical skills, 1 day, I would say, communication skills. Okay, so that was something that's new. What we did actually, the minute we came to know more about the structure of this exam, as the nature of the exam started to uncover itself, right away we got a good feeling of where this was going, and especially after the first webinar NDEB had, where they referred to an article called the ACFD article. It's pretty much talking about the competencies a dentist should have graduating from schools here. We started our work on this course.
One of the questions that we often get asked is, what's the difference between the clinical part that we had with ACS and now with NDECC. So maybe I'll ask you, Dr. Fersan and Dr. Ban, do you see a big difference, a big shift in the new exam and how you are preparing dentists for the exam?
So the difference between the skills and this exam is basically now we have the same part as we had before, which is the skills components already available in this exam. And it was, there was an addition of kind of a new exam, which is the situational judgment part, as Dr. Marwan described it. And this is just a new skills the dentist has to acquire. And it is not, I would say, like a hard skills to be acquired. It's basically a communication skills, how to talk with the patients, how to engage with them, how to give them the right way. Like as an example, treatment planning, or if they have a situation that the patient might be involved in like any kind of hardness, that how you can relieve them, because we are not only focusing, or as a dentist, we are also dealing with the patients as a human, and we are trying to be an advocate for the oral and general health in general. So this is, I would say, like an extra part was added to it. So yeah, there's an extra work need to be done towards it. And overall, like what I can say, like what I've seen from the first course, and we're now carrying on with the second course, people from the day one up to the end of the course, I can see a lot of improvement. And that's one of the things, just honestly, motivate me usually to keep going. And when I do even the mock exam, because the mock exam is like the last part of the course, I feel like no, like there's a huge difference at the start, because usually I'm from those who start with them from day one up to the end, and I like how the change is happening toward it, and how things are going in general.
Same question to you, Dr. Ahmed. Do you feel a difference in the difficulty that trainees are facing in preparing?
Now, in terms of difficulty, I don't think there is that much a difference. They still need to prepare the same way. If I will comment more on what I see a big change between the skills, let's say the practical part that was before and now, is the way you want to pass it. Before there was a lot of room to pass. Right now, it's a little bit more strict. Before they allowed you, let's say, to fail in a project. Right now, they can't allow you anymore to fail in any project, which means you need to prepare well to pass this component. Other than that, the changes in the criteria, especially all of the instructors also are aware of, they kept changing, the NDB, they kept changing their criteria, which is, I would say, in a good point, that they are somehow addressing some points which we as instructors, when we deliver it to the students or participants, I think they are in contact with the NDB, and then they end up adding or modifying some of the criteria points. Criteria has changed a little bit. It's more open now. Before it was, let's say, it's almost strict to fine details. Right now, criteria is more open, and it shows that the examiners, they want to see how the participants will be practicing as a general dentistry and not following a specific rules that they are setting it up.
Before we move on to the next question, I just want to mention to the attendees that we will be taking questions towards the end of the program. So please go ahead and use the chat box and leave your questions there. But I wanted to keep you on skills and talk about the duration. Because in the past, we had a 3-month course, we had a 5-month course. Now, of course, things are very different. So how do you guys feel that doctors should be preparing in terms of the amount of time they should be investing?
Well, it depends on people themselves. Some of them, for new people, we don't recommend taking only 3 months course in order to, you can't be ready in 3 months only. So we advise them to take 6 months. That's like 2 courses. Now for other people, and the improvement is different from person to another. You can't compare yourself to someone else who's been practicing. So people still like practicing from before COVID. So yeah, now they need the new people, for sure, they need more time to practice. Don't rush assuming that there's unlimited chances in the exam. Like whenever the instructors tell you that you're ready to go, then go. Please, like, don't. We see that, we notice that people, they want to rush into the exam because of the unlimited chances. But just remember what Dr. Ahmed said, like, now there is no room for any error to happen.
Yeah.
So in the past, you have that chance to pass with failed project, now you cannot pass it.
Right. So I guess the psychology is changing, right? You have unlimited attempts, but you also cannot fail a project. How does that affect students when they're training, when they're just about to go through the exam?
Actually, I just want to comment on what Dr. Pan was saying. The transition is scary. To me, it was scary, and I have been talking to people about this because we had a pool of people who have been practicing for 2 years during COVID, and they didn't get a chance to go to the exam.
And they did not stop.
And they did not stop practicing. So they're prepared, they're well prepared. They're waiting for a chance to be able to get a seat, which was also an issue. People are struggling to get a seat. Like, if you want to see what happens the day they open or they announce the seats are going to be open, people are fighting to get a seat. This actually was propagated to people who were not prepared, who just started the course. So they actually got into the hype of, let's get a seat. So now everybody's trying to get a seat. Some of them are prepared, some are not. But to summarize, back in the days, before the introduction of the situational judgment component, and when the criteria was looser, and what I mean by looser is like you're allowed to fail one project, the minimum we used to recommend people to prepare was half a year. And that was just one exam. Now what's happening is, and I do understand people have to go through a lot because now they have to prepare for 2 exams. So they're trying to manage the financial, they're trying to manage so many things, but they're spending 3 months to prepare for 2 exams, where it used to be 6 months to prepare for 1. Okay, and that's the scary part, is we're trying to tell people, take a breath. It doesn't mean that if you got a seat, you're lucky, because I even see people congratulating each other for getting a seat in the exam, and they still have not completed the course. You know, so no, make sure that, but back in the days, people used to take the course, get the recommendation, get the green light from the instructor, then they book for the exam. Now people book for the exam and they're only 1 month into the course. And then they ask us, am I gonna be okay? No, it's too early.
I just add one point. Time is, I have seen from, my participants in here, that they end up, even if they finish the projects in a nice way, they are not finishing it on time. Right now, the skills exam is just only in 1 day that they need to finish all projects. And the time is barely made just to finish these projects on time. So most of people who has been practicing for a while, they come to me and they say, yeah, I'm doing everything is good. I'm taking good evaluation, but I can't manage the time, which is affecting finishing the projects at the end. So they end up even losing one project because they couldn't finish well. So time management takes time. And it's not just only about the quality of the work you need. And I think the NDB, they meant to do this. They want to see how you will manage to work under stress.
Mm-hmm. Can I add one more point, just to compare the back in the days and now? So what Dr. Ahmed was saying, back in the days, if someone was slow, but they're able to produce nice work, they can sacrifice one project and pass. Mm-hmm. They're able to sacrifice a project and still pass. Now they cannot. They cannot sacrifice any project because they're not allowed to. So they have to manage the time and they have to get quicker.
Mm-hmm. Mm-hmm. Talking about time and managing that, as you said, 2 basically exams within 1. How do the students, how do the dentists juggle that? You know, it's basically 2 different exams within 1.
Like generally, if I want to talk about that part, like they are like technically both exams. There's 2 different ways to prepare for them. One of them you're going to be study and practice how to speak, how to communicate. The other one is basically you're going to be sitting on a dental chair and working on like mastering those projects themselves. So like can you juggle them both together? I would say yeah, but you need the time, as everyone was talking to Ahmed and to Marwan. The time is really important. You have to give yourself the time. And there is another factor also playing around that. Each one of us, we as human, I'm talking about that, like some people, they are really skillful. Some people, they need to learn that. It will take them more time to be more, like to be good more about it. Some people, they are more knowledgeable. They know knowledge, they study, or they get to know knowledge a bit faster than others. So everyone should know his or her weaknesses and strength and work on it. And the time is needed. And 6 months, I would say those are the bare minimum to be able to really practice and master both of them and be able to go on successfully finish for both of them.
Okay, let's switch gears a little bit and start talking about situational judgment. And I wanted to get a little bit of the kind of background, behind the scenes view of how we at prep doctors prepared for this course and for the exam.
Okay, so I'll give a general overview. So actually, the preparation was very intensive, and it took the whole team. In the sense, so I just want to mention instructors that are not with us today. Dr. Lesia Waschuk, I think she may be able to join at some point. Dr. Khalid, he was also helping out. Dr. Ibrahim, he may be able to join. Dr. Shaukat and Dr. Maz, those are not here, so I mentioned them first. But in general, actually, the best way to prepare for this course was to have a mix of two types of people. People who went through the Canadian system, because this actually is part of the Canadian education. So now when we talk about situational judgment, we're talking about the culture of dentistry, learning the culture. So we have people who were educated in this culture. So for example, I myself went through university here, Dr. Alaa, new graduate, Dr. Shaukat, and then we have Dr. Fersan and Dr. Ban. They learned the culture through the equivalency process and through experience. So they were not educated in the system here. And we both got to the same level in practice. We're both practicing outside. So Dr. Fersan and Dr. Ban, they were with us to give that perspective of the internationally trained dentist. And we are giving how things are done from a university perspective here in Canada. So we were checking each other out. And now if you want to come to find out who's best at delivering the information, I would say Dr. Ban and Dr. Fersan are better at delivering the information to internationally trained dentists because they themselves went through that struggle. Okay? Well, if you look at people who went through the university here, it becomes second nature because you've been spending like 4 years going through that, especially the last 2 years. So when we built the course, of course, we have fresh blood, Dr. Alaa, very fresh, the most updated. Just University of Toronto, I'm old now. Okay, it's been since 2009, so outdated a little bit.
Dr. Amro as well.
Dr. Amro also like from university.
Not too much, like kind of in
the middle. In the middle, yeah. And we still have Dr. Shaukat and Dr. Maz. They're still going through the program at University of Toronto, so there is still the ongoing update, and of course the experience and the extensive experience in this field. Dr. Lesia, she worked at RCDSO before, and she has a lot of, and I think she did her PhD in this side of dentistry as well. So we sat together. Now, of course, Dr. Alaa participated. She can talk more about it. She's the one doing the problem-based learning skeleton. So she was juggling around with how to cover the 5 competencies, because we have 5 competencies, and we had to change people's mentality, because people came out from AFK and ACJ, where it's a multiple choice exam, to now they can talk about things. And they're used to the black and white answer. Now there's no more black and white answer. It's more of a gray zone that they have. So that shift in mentality is not easy. It's not easy on them. So we had to hammer this. And of course, those early days we were role playing. Everybody acted from the team. Everybody. Dr. Alaa would write scripts. The scripts, they get checked again by Dr. Lesia. Now Dr. Lesia is not with us. Dr. Lesia is the auditor. You know, she audits.
She is online, Dr. Marwan.
She's online.
Yeah.
Yeah, I know. She's. I know she's watching, but I don't know if she'll be able.
She's saying she can be unmuted if you want. Yeah.
Oh, okay, nice. Oh, she's okay. So yeah, of course, Dr. Lesia, if you can. So Dr. Lesia actually, she audits what we do. She is. It's always fun and I would say intimidating to talk to her at the same time because she knows so much. So
yeah.
She knows so much. So we always want to get her to check things, and she's actually very precise, very meticulous, very accurate. Choices of words, you have to be very careful because she'll make sure that it's perfect. So she helped out. She was in the background actually. She's the expert we fall onto. Whenever we have a debate, we want to check that we are on the right track. She's the one that we go back to. Dr. Lesia, if you wanna talk more about this.
I think you should do it for the marks.
Yeah, she's. We'll try to get IT to bring her in. But whilst we're doing that, I wanted to come to you, Dr. Alaa, and Dr. Amr as well. From the local perspective, how do you feel like what you're experiencing at the university or in practice in hospitals here has allowed you to translate that to the course and to help the trainees prepare for the exam?
So one of the challenges and the difficulties that I faced in the beginning, like as Dr. Marwan was saying, changing the mentality. So as internationally trained dentists, like we all know how to like drill a tooth, make a crown, like do a cavity. But the difference here, how to communicate with the patient. So I was telling the candidates in the course, the situational judgment component, yes, it's additional financial burden, time, stress, but it's very beneficial. Like this is the bridge from the gap between the graduates from the schools here, and if you compare it with the people who finish with the direct licensing, it's the bridge who will get those people together, like how to deliver the information to the patients. The other thing, people like me who are trained overseas, like again, we have the skills, but how to communicate with the patient. I found in the beginning some resistance with the candidates, like we weren't told this before back home. So in the beginning, there was some difficulties to tell them it's a little bit different here, like informed consent, talking about treatment planning, the options, how to speak with the patients, how to deliver bad news if there is a problem. So that in the beginning was a little bit struggle, but by time and by having like multiple practice sessions, the mock exams and so on, we are seeing huge improvement in the candidates' skills.
And Dr. do you see any similarity maybe in what you've just recently completed with the University of Toronto and what's required for this exam?
Yeah, definitely. Actually, the article that they posted to guide the candidate, the ACFD article, it's the one that we built all like our cases, and we have like to do the portfolio before we graduate and submit it, and like reflect on our experience working with patients in the last 2 years. And we are required to use this article to guide us and to write about each of the competencies. So the health promotion, professionalism, patient-centered care. So we will use each of these competencies and give some examples of what we did in the clinic. So even like building the case-based learning for the course, it was like very easy to like simulate these cases, especially that you went through it in the university. You had like, even like some of the cases that we are giving the students, it's actually real cases that we encounter, like whether me in school, like or any of the doctors over here. And given the fact that I was actually an international trained dentist, so I went through these exams before joining the university. So when the candidate comes to me and they're like, oh, we are shy, we like have like our range of threes, we don't know how to answer. And I'm like, I was in your place. And the way to get to it, they are like, oh, how do you make these sentences? Like, or they would be like, oh, wait, can we write this? I'm like, practice. We always like, they will get sick of us keep saying practice, 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 because without practicing, you're not going to get there. And this is why, like, as all the doctors mentioned previously, time is like very crucial for preparing for this exam. Like being shy or like feeling intimidated by us, think about it. Like here, they will be practicing in front of a group. In the exam, it will be only you and one person. So it will be like much less intimidating instead of like all these people listening to you while you are talking.
And all what we are trying to do is to let them know we are not only preparing them for the exam, they are getting the bonus of being prepared for real life. Like once they go into the market and start working as dentists, they will find how easy and like how manageable it is for them to actually work with patients. We are giving them the bonus of avoiding all the legal and ethical problems that they might encounter because they are already well prepared here. And obviously they will have to take, I think, an ethics course to get their ASDIS registration. It would be a piece of cake for them after our course.
Yeah, so yeah. Even I have like some colleagues calling like from other provinces in Alberta and Montreal. They are asking about, they finished their equivalency process before the situational judgment was introduced, and they are calling like asking if there is any online service they want to take the course. I was like, what do you want to take it for? Like, because I hear like a lot of positivity or a positive feedback about the course, and it's very helpful with their daily practice in the clinic. There, yeah.
That's very interesting. I did want to also talk about the physical space that we have created, our brand new mock exam center, which we'll be showing to the world very, very soon. But I wanted to talk about what it took to build this, how we built it, what are the specifications, and really just get into the details of our new mock center.
To build the center, we had to do a lot of research. Actually, I want to take a step back, talk about preparing for this course, right? So I remember the discussions we had on the topics, because Dr. Alaa was like, everything on ACFD and Dr. Lesia has to be taught, okay? Because we have to over-prepare people. We have to make sure all the competencies are covered, every single point is covered, even though sometimes it looks challenging or not relevant. Like, to give an example, the most hated topic to be taught, critical appraisal of articles. Yeah, so this is a topic people, they don't like. So we actually built it based on that. The simulation center, we wanted to have it ready by the time the exams are being administered so people can have the mock exam. Again, we don't know if the questions are going to be revealed to people inside the station or outside the station. We don't know how much time each station is.
The break.
We don't know if there's a breaks in between. Like, there's a lot of unknowns. And we just know there's 10 stations. Each station is, each competency is going to be 2 stations. So we were given, like, by the NDB when they first released the information, very, very limited amount of information on how the exam is going to be conducted.
We started before the NDB started.
Yeah, well, of course, construction needs time.
No, I mean, we started with the mock exams before the first exam from NDB.
Yeah, of course, yeah. But I mean, our guess was that we started to look more at pharmacy. My brother is a pharmacist, so how their exams are conducted. Like, these station-based exams, how are they conducted? And we started to ask, okay, do you see the question outside? Do you see it inside? Is there a timer in the room? Or do you have no sense of time? And they give you a bell. So we're asking these technical things. And of course, the first set of exams we prepared it with the worst setup for the candidates, because we wanted to give them the worst expectation so that they're not surprised in the exam. So they had no sense of time. They were given a reminder one minute before the end. The question, they had to read it outside. So that's how not inside, that's how we built it. And then only after the exam was conducted, we were able to know more about exactly the technicality, more of how the exam is conducted, and we modified accordingly. So we built it based on, I would say, educated guess on how things are going to go.
Yeah, I'd like to acknowledge that another of our senior instructors, Dr. Ibrahim Saadeldin, has joined us. And now that we're in full swing with mock exams and the center is pretty much finished, how do we feel it's going? How's the reaction been from students, from dentists?
So I can
go ahead, Doctor.
So I can add in that point. So I'm involved more with the mock exams of the situational course. So what I've realized doing these mock exams and having a discussion with the students who are taking the course is that the people are actually not only for the exam purpose, but the people are actually benefiting from the experience itself, and how to handle difficult situations. And not me saying that you're going to see most of the difficult situations in your office, but you can be exposed to these difficult situations, and how to handle these difficult situations is very important. One of the main difficulties that international state-trained dentists faced when they entered into the market, as the doctor was saying, is how to deal with these situations, how to deliver bad news, how to deal with a patient who has suspected lesions of malignancy, how to deal with problems with confidentiality, problems with ethical dilemmas. So these are very crucial types of situations, and we're not taught the management of these patients back home, or so that was very, very important. It's for me and for the people who are in front of me. So I believe that people are experiencing these exams, and they are benefiting from them both for the exam and for their actual career afterwards.
I would like to add one more thing. One aspect that people don't know until they go to the exam is they get recorded, so they get to watch themselves perform. So we have it in 2 days. So the first day they go through the exam, so they get that experience, they get recorded. And then when we do the one-on-one discussion, they watch themselves again. And then we always advise them, this is how they should incorporate practice. Record yourself and see how you performed. And when you watch yourself,
they realize once you start the video, they tell you, oh yeah, I know I made a mistake there. I shouldn't have said that. I should have done. They already, because they see themselves, it makes more sense for them.
You will accept it more when you tell them you said this. You shouldn't say that word in that situation. They say yes, I totally agree. And when we are marking, I'm checking every single word, the reaction, if there is compassion, if there is empathy. Like the thing is, they come in, they know those are actors. So sometimes there's some lack of compassion, lack of empathy. I'm telling them, like in real life, like I'm a patient sitting in the chair. If I'm telling you a story about my personal life, interact with it. Like don't just listen and ignore what I'm saying. So it's very beneficial for the exam and real life. And they come and they ask, are we gonna get those type of patients in the clinic? Definitely, for sure. Like the difficult patients, the patients with low income, the patients with like some complex medical history. It's normal, like daily basis.
Yeah. So the idea is not only to focus on the actor, but also the camera, which is actually the thing that is examining.
And just like to add up to what the doctors were mentioning, I noticed, like especially at the beginning of the practice, that candidates usually they are just focused on, I have 10 minutes, I need to cover all the points that are in my head. So they get caught in this idea and they end up talking to the patient as if they are talking to a machine. And I feel this was the biggest difficulty that we were trying to change. Like, it's okay, you can talk, you will discuss with them, let the patient guide you, and it will flow. Like, don't just focus that you have like some sentences that you memorize and you just wanna take them out. Like, just go, consider it as a normal conversation. Like, look at them, they are patients, not machines, not robots. And I think maybe Dr. Lesia had something to add, but she was having her hand up. Dr. Lesia? Yeah.
Yes, thank you. And I wanted to tell you that we have a few questions in the Q&A. As when I logged in as an attendee, was when I couldn't enter the chat, but the Q&A people are using. So we have some questions. We also have positive feedback from one of our very first students to take the NDECC situational judgment course. And it's really nice feedback that she's given because it shows us that we're on the right track. And we are absolutely, continually improving the course, which I think really speaks to the professionalism of prep doctors and the real sort of educational rigor that everybody brings to the preparation of courses. So I wanted to correct what Marwan said earlier about me, and then I wanted to talk a little bit about just some points that came to my mind as everybody else was talking. So I don't have a PhD, I have a Master of Education. I do have the regular experience that Dr. Marwan talked about, 21 years at the Dental Regulatory Authority in Ontario, and I've worked at, I think, 7 different post-secondary institutions and all sorts of different health professional programs. So I bring a different kind of experience than some of my colleagues do, but absolutely it's a team approach. And I think everybody brings their best and everybody brings something unique to the table. And I know that I learned from my colleagues, my teaching colleagues at Prep Doctor. And I do appreciate Dr. Marwan's compliments, but really I'm not very intimidating. So when you get me in special topics, feel free to ask questions, feel free to contact me by email in between. So in the development of the course content, I wanted to say this. We've made sure that the most common types of scenarios that come up in practice, as Dr. Ibrahim said, are addressed. And the ethical dilemmas that we're talking about are things that both has been taught in the accredited programs, also the kinds of cases that have resulted in a complaint to the regulatory body, sometimes lawsuits and so on. I mean, we are trying to prepare you in the most practical way, not just for the exam, but for how to avoid and deal with and respond to any complaints that may come up. And it's, if a complaint comes up, it doesn't mean that a doctor is not a good dentist. This is what happens when we deal with the public. So we teach you how to deal with difficult patients in this particular course, and you have the experience of us as difficult patients when we're role-playing in the practice sessions. And I've seen the other instructors also during the examinations, and they're amazing. I mean, they really are amazing in challenging the attendees, because we want to challenge you so that you feel confident when you're in the room. And from the feedback we got from the one instructor, she says it worked.
Absolutely.
Thank you.
Thank you, Dr. Lesia.
And to add to whoever was the candidate that gave the feedback, I was myself a student at Prep Doctor before, and I used to always think that I get the craziest scenarios here, whether in the AFK or in the judgment or whatever. But this is how you get prepared. So whatever you find in the exam, it's not going to intimidate you. And I'm glad that students are seeing this as well here in the situational judgment. As Dr. Marwan said, we always like to over-prepare, so they will be as relaxed as they can in the exam day.
To add on that point as well, this is also something that you actually see during the course. So the people who do the mock exams for the first time, when they come, because they do it multiple times, so when they do it for the first time, you see the intimidation, you see the anxiety in that person. And then the second time, after they have had the feedback and they have practiced a little bit more, you feel a big difference right away. So the difference is always noticeable. There's always improvement. People are always improving. You're not going to get stuck if you don't know how to deal with a certain patient, because you're going to get guidance on how to deal with him. And the next time when you come and do the same mock, you'll have more confidence and you will feel more relaxed. And I think when you go to the exam, you'll have the same feeling and you have the same experience, hopefully.
And people would notice that although the scenarios change, for each competency, no matter what the scenario is, there is some guiding blocks that we give them. So it doesn't matter what the question is, they will always be able to answer. I can give any of the candidates a totally different question for one of the competency, but they have the keywords and the key information that they will use to answer the question.
Kind of a set standard or a way to just build up the answer on.
Right. Okay. I do want to get to some of the questions that people are posting in the Q&A box. But one of the things that we get asked about quite often is the ADEC simulator, and whether this is actually something that is really important, that our trainees work on those when preparing for the exam and going through the mock exams that we have. What is the importance of this particular item, the ADEC simulator?
Okay, so can I answer that question?
Yes,
I'm going to be very honest with this question.
Yeah.
I have a follow-up after you.
Okay.
I will have a follow-up.
So the physical benefit of ADEC is not as much as to the psychological benefit of ADEC simulator. So because the exam, the stress level in the exam is so high, and stress management is the most important part after they have trained, the more you know about the exam, the less stressed you will be. So is it so much different to practice on an ADEC versus any other simulator or a bench unit? Not so much. If you actually come to someone who's relaxed, working in the real market now, you bring them, they can tell you what's the big difference between these three. It's the same. At the end of the day, we have to handle it. But when you come to someone who's going to the exam, the more they know the environment and the more they know about the unit, the less they have to discover during the exam, the less anxious they become, and the more comfortable they will be. So do I think it is important? Yes, it is. I think it's very important because the more known factors they have going into the exam, the less stressed they will be and the better they will perform. Because most of the time we see candidates, like we have I always talk to people about two sets of people. Some people who are laid back by nature, they may not be as prepared as the rest, but they end up clearing the exam because they're so laid back. Exam doesn't stress them out. They're a very small minority. And there is a bigger majority who are very good at what they do, but when they get to that high level of stress, they screw up the work. So we want to reduce their anxiety as much as possible, and ADEC is one of those.
Yeah, it's almost the same answer, which is kind of psychological part. One of the things I always tell to the dentists who are doing those exams or those mock exams, the result is not the most important part of it. So what the evaluation is when it comes if you did the exam over ADEC or if you did it not over ADEC or if you did the exam in the situational setup or not, it's not about only the result. It's about also the experience you go through it. You go through the skill or through the stations from one to one, and that's always like something you lower that will lower down their like the anxiety regarding what are the unknowns they're gonna be in the exam. To be familiarized with it, to be familiarized how to deal with all of that, like let's say in the situational day, those sensation back to back, or in the skills day, those 7 projects they have to do within 8.5 hours. So all of these usually, when they know more about them, it's going to be just relieving them from that part, and their focus will be just toward answering these questions and moving on.
There's one more advantage, they're very good quality.
Yeah,
so they're durable.
Yeah, they definitely look great. Okay, let's jump into some of the questions that we have. And if I can summarize the first 2 questions, they're very specific, but I think a good summary is, when should I take the situational judgment exam? Is it something that you should take right before you go? Or is it possible to take it and then have a gap? Like, how do you feel about this gap between the course, the mocks, and the actual exam?
Okay, so when should they take situational? My answer is as soon as they clear judgment. Because the minute they clear the ACJ, the 5-year window kicks in. So although it's unlimited number of attempts, but there is a time frame they have to finish. So the sooner the better. Also, it's a skill. The skill comes with practice. You're not going to take the course right before the exam and be able to go to the exam. You have to take the course. Usually, always the first 3 months, you're learning. You're not going to become good at what you do. You're just building the foundation. It should be followed by practice. The practice can be, of course, independent or can be guided. And we got a lot of requests, by the way, about opening a practice course only. And we have launched that. But we did not make it public. This course is only for those who took the first course with us. So if you have taken the first situational, you can sign up for the practice, because the practice is building on the information we taught before. And it should be a continuum. So they can continue and then they book their mock exams. Now, the minute they build their foundation, as soon as they finish the ACJ, even disconnecting from taking a course should not be disconnecting from practicing. Because practicing communication at home is easy. Record yourself, like dedicate 2 hours a day or 1 hour, open up a camera, talk about topics that you have learned, watch yourself. So the practice should be there. And I always give an analogy in courses like driving a car. I can give you all the rules and how to drive, and I can talk about it for a year, but you're not going to become good until you start driving. And the more you drive, the better you're going to become at understanding how to handle the roads and so forth. It's exactly the same thing.
Okay. There's another question about somebody who has taken ACS previously and then taken the online course. Do they need to buy new materials, take another course? Would that preparation be enough to go for this new NDECC clinical skills?
So regarding this, the people who took the ACS before and now they have to change and to adopt the new system, unfortunately, I would say they were the most disadvantaged in terms of preparation. So in terms of financial, like how their finances will go, they unfortunately need to spend more money because the criteria has changed. Maybe it loosened up a little bit. I'll talk about the criteria of each project. The passing, how to pass the exam is also different than before, as the doctors were mentioning, let's start. So generally, they have to do that extra. They have to buy those extra materials because it's not, I would say, recommended from us or from any one of us. They would never recommend you to work on the same instrument you used to have for the skills, because in the skills you have the freedom of buying any dental instrument and use it as it is, as when it is just a dental instrument, and you can use it in the exam. Now, no, there is just a list. The NDEB will be providing the instruments for you. You will go without instruments, and you have to use those instruments. So your preparation should reflect it, or the instruments you use in your preparation should be similar to the instruments you're using in the exam, because you don't want to, again, get surprised. You're going to just master the skills with these instruments. And these instruments, they are, I would say, good enough to really finish any project. But they are not, like, I would say, extremely, like, they are not versatile. There is not too many different options. They are very limited, and you have to master everything within those. Okay, is it doable? Yes. But the freedom of having any instrument as before is not anymore, so you need to buy the new instruments.
To talk about this point, just when the instrument list was released, actually, the first two who went through an exam with these instruments was Dr. Man and Dr.
Yes.
They had to go through, we made them here at Prep Doctor go through an exam with those instruments, because they actually were, did the ACS back in the days where they were allowed to choose their instruments. So actually, when they went through it, they also felt the struggles that people are going to have, which will give them ideas on how to tackle things better.
I just wanted to echo what everyone said about the situation, and I'm sure that none of this huge number of online participants would agree with me, but I think situational judgment exam is a good exam, and it should have been implemented long time. It's a way that, I usually tell most participants, I can get, let me say it in this way, I can get anyone and let them practice well on doing an MOD cavity, and then they will end up doing it the same way that I want them to do. But again, it depends on the skill. We have so many miscommunication in the market between the patients and the dentist. So as everyone said, yes, the course will prepare you regardless of what your experience is, even if you are a specialist, even if you are a new graduate. It adds a lot. It's even, you can ask any of the instructors. The course is, specifically the scenarios of what cases that they introduce you through each mock exam or during the practice. I can assure all of the people that definitely you will be facing one or two of these patients, and maybe in a week or in a day. And you need to know how to deal with these patients. And the problem with this is, from just this short experience with the situational judgment, I've seen a lot of people that they are well experienced, but for example, like eye contact, it's one of the way you communicate with the patient. So one of the participants was telling me, I'm good in everything except eye contact. I can't get into this eye contact. So what can I do? As everyone said, practice makes perfect. So the more you practice, like what Dr. Marwan said, record yourself, watch yourself, meet people. I even make fun of people. I tell them, you know what, when you go ahead and order a Tim Hortons coffee, don't look around when you order this coffee. Look into the eyes of the cashier and just practice eye contact. This is the only way that you can improve. And I think the way the course is set would prepare anyone from 0 to 100. So anyone who is, regardless from where you come, and as Dr. Amro said, as an international trained dentist, different approaches in different countries. And here, when you come in, you need to take the summary and the conclusion of how the Western way works. And this is how the situational course will prepare you.
Yeah. I want to comment how he started by saying a lot of them will disagree with what I have to say, that it's a good exam. And I'm one of the people who want to bring the other side of the story. And to bring one thing that is important, the attitude towards exams. What is your attitude towards exam? So actually, if I look at myself when I was in university, all I wanted to achieve is learn the material to pass the exam. Like my main focus was to pass the exam. Then after you graduate, all of a sudden you're gonna find yourself, no, I need to go review this material because now I have to apply it as part of my daily life. The same thing is gonna happen to candidates. It is a stressful exam. So now they're not looking at what's gonna come after the exam. All they're looking at is, how can I get through this exam? But as Dr. Ban mentioned, there are candidates calling her after they finish the license, they want to take the course. Those are the people who want to know now how to apply this in their daily life. So what I tell people, if you try to actually take this exam with a positive attitude, in the sense is, you are not there just to pass the exam, but you want to become a better person in communication, a person in giving the info, you will reduce the anxiety. And those are a few candidates that can do it. I'm not going to say it's like easy to do. But I remember there were some candidates in skills that used to say, we enjoy when we come to practice. Now, of course, if you have that attitude, then you're coming here to have fun and at the same time prepare for the exam. But if you're coming with the already intimidated that I'm going to start my preparation, I don't want to go subjungival, I don't want to do this, I don't want to do that, then your experience is going to be a stressful journey, which is the majority of people. Now, some people may say we're getting a bit philosophical over here, but the attitude is very important, by the way. Is always to try to bring the positive out of the negative. And how can you reduce your stress? I'll go back to point number one. If you allow yourself enough time to be ready, you'll be less stressed. What's causing people stress is, they start 2 courses at the same time, they book their exam immediately, and now they have this time crunch, like in 2 months, I have to be the best in skills and situational and go to the exam. Of course, you're going to be so stressed out and you're not going to be yourself.
I think one of the things will happen eventually, I'm talking about this is an opinion regarding this exam. I think NDB, they will just split them. And if they split them and you will be booking one of them at a time, I would say it's better usually to book one at a time and finish it and continue. I don't know if this will happen, but from our, I would say, experience with NDB, that might happen later on. Because when you pass one of them, or God forbid you could not make the other one, you still have to do just the part you did not make. So it's going to be even less stressful at that situation.
There is a question as well about maybe I'll just read it. What about people who got an NDECC course, the first one in September, and basically, I guess the question is, how are we evolving? How is our course evolving now that we know more about the exam? Are we implementing differences in the way, especially with situational judgment, because this is something very new? Have we been able to update things, and how frequently is that happening?
Okay, we're only in cycle 2.
Right.
So,
by the way, cycle 1 just was in August.
Yeah.
Okay.
Let's say how frequently.
Yeah.
The frequency did not build up yet. So.
But if you can forecast for the future, do you feel like there will be a lot of evolution?
I'll tell you one thing that happened actually when we first started the course. We were predicting that the type of stations they're gonna get is role play, interview based, and written. Okay, but later on, after we finished the first course, the NDB announced that it's going to be 5 role play, 5 written. So they eliminated the interview style that can come in some exams. So that was one modification. Now, what used to be interview style became written. So that was an update that we did. In terms of content, to be honest with you, we did cover all the ACFD competencies. So we covered the content. So in terms of updating the content, there's going to be no major updates to the content, but there's always updates on the examples that will clarify the content. So there's more cases to practice. There's new cases and new scenarios and new angles to look at the same concept. And at the end of the day, when you give more examples, the concept becomes more clear and they become more confident to handle that example.
And like just to comment on what Dr. Marwan was just saying, I think our candidates noticed this regarding, especially for example, health promotion, because this was like an area that everyone, once we introduced it, they were like, what is health promotion? They weren't like able to understand how they are supposed to address these stations. But at the end of the course, they mastered it even maybe better than us. Like they would be saying the answer and we wouldn't even find one mistake to comment on. So, and regarding the evolving, like we usually check our like material every week again, like whatever we already gave in the first cycle, we make sure that like any minor changes or anything, and we always reach out to our like previous candidate who still didn't go to the exam if we feel that there is something that will benefit them for going to the exam. I think Dr. Marwan already like tried that. Like whenever we find like small changes that we want them to be aware of, we either send emails, we reach out to them. We're always like in contact with them until they go to the exam. So
and they're coming for mocks as well.
Yes.
So we see them for the mock exams. We update them on something that we found, like more examples. I would say still the content does not change.
Yeah, it's almost the same, and the changes are not that much generally. Just the amount of practice. I would say like questions themselves. This is, I would say, what is kind of getting slightly changing. The type of the question,
I can take 2 slides and I'll make 20 questions from just 2 slides. Different questions where the answer is the same concept, because scenarios are so many. We've made hundreds of cases that we are using right now. But I mean, at the end of the day, ethical conflict is an ethical conflict. It's gonna be, you just have to identify the sides and solve it.
Yeah.
When we talk about health promotion, the social determinants are the social determinants. It's a list. It's not gonna change. But how the scenario will come, that's what's gonna change.
Yeah. What has been the feedback from candidates who are going through the mock exam center and the experience there?
Well, I have one feedback that was like a week ago. One of the candidates talked to me. Like regardless what the results will be in the exam, he took the exam already and he took the course. But this course gave me a lot of knowledge on how to deal on daily basis with people, like at the grocery, at the bank. It's not only in dental clinic setup. So yeah.
Like a funny part is, even like students are using the words we are teaching them against us now. So if we are telling them, oh, we can't provide this, they are like, oh, this is injustice. You can even see like that,
I think the main problem was communication. Communication, I think, became much stronger in order to how to communicate properly and in the proper way with the patient, how to make sure that the patient actually understands his situation, and then to tell the patient what are the options for the treatment. So the communication became much clearer. That's, I think, something that changed throughout the course, that people became more effective in doing that part.
There is one side that we are updating, actually we're working on right now, which we incorporated, but I think we need to improve. That was one area of improvement. Layman language, the emphasis of layman language. Because what we notice is people have the knowledge, they know, but at the end when they come, they want to simplify it to someone who has no background in dentistry. So these words, they have to be oversimplified. So that's to communicate in a layman language. So that's something, that's one of the side of the updates that we're doing, is to add more on the layman language.
And we saw this in the mock exams. They come in, they use like the dental terms, like anterior, posterior, like stuff like that. So like I'm telling them, like a man coming from the street, sitting in the chair in your clinic, I won't be able to understand what you're saying about like numbers of teeth, like tooth number 46, like what you're talking about. So we have to, and during the marking, I stopped the recording, like you said this several times. Please don't do this.
We translate for them, by the way. I would say like, okay, you said denture, it's a plate, or it's a flipper, or crown is equal to cap in layman language. So we give them the layman terminology so that they can actually...
Just to comment on this, like people who finished our first cycle, they were provided with a glossary of these terminology actually.
Yeah, but I mean to implement it more in practice.
No, so now in the mocks, you guys should be more strict with them. They are not supposed to do that.
We are. Yeah,
we are strict with them, but I mean the layman language, if you see, there is one side that is providing people with terminology and the information
And to
make them use it constantly. So that's why that brings us to the point of the practice course. Because yes, you can provide them with the glossary and they can also search it and find as much glossary as they want. But until they implement it, that's when they can actually be able to.
I always tell them when I discuss it, and it's one-on-one discussion, and I say one word like most of the time, you're supposed to be the one who's clarifying things, not making things also more, I would say, not understandable. Like sometimes you will see people using this, that, those, and like, no, what are these? What are you talking about exactly? You have to be clear about it. Or things, you have to always not to say just things as things. You have to really identify what you mean by that. Sometimes they feel, oh, it's fine to say it because we might be dentists, we understand each other. Yeah, that's true. But when you are a patient who just came in, he's let's say an engineer, well educated as an engineer. He doesn't know about dentistry. And he's not supposed to be aware totally about what's happening inside in terms of science of dentistry.
Yeah.
And even like we made sure, especially in the practice sessions, like at the end of each session, we would like always collect feedback from the students. So sometimes they will even bring to our attention stuff that we might think that it's clear or it's easy, but they will be like, oh, we have like trouble how to start like a written station or how to end a written station, what sentences we can use, or like how can we break an ice with a patient? Is it okay to say this? So we always like try our best to give them guidance and to add this and to the course, like always update.
Interesting. So we're almost out of time, unless there's anything else any of our instructors would like to add.
I'd just like to remind, just emphasize one point again, practice. And for people to take things seriously from day one, because there are still a good portion of people who think this is like the AFK exam, or they're looking for answers. Like sometimes they come with a question, what's the answer to this? Do we do this or do we do that? And then here we stop them and I tell them, can you talk about it for 7 minutes? They just want one word answer. So they have to practice talking. They have to practice how to interact. And they have to take it from day one, because it's a build-up. They will see the improvement over time, but they can't just study for 1 week and be good at it.
And I just want to add one thing regarding the like white and black answers in questions. Like in real life, you will face dilemmas. You will have like multiple scenarios and multiple outcomes. So some cases you don't have like one answer. You have to investigate more. You have to think, if that's the case, my approach will this. If that or the other scenario, my approach will differ. So we teach them that you have to investigate more about this case. You have to think, and based on the scenarios, we'll have different outcomes.
Absolutely. I think we could probably talk about this for the rest of the evening and the entire weekend, but unfortunately, we do have to end it there. I want to thank all of the amazing instructors for giving us your time and shedding some light on this exam. And a recording of this video will be on YouTube for everybody to take in. And if you have not registered for the exam, we do have courses that are available at prepdoctors.ca. But from all of us here at Prep Doctors in Mississauga and Richmond Hill, we'll say farewell and have a good weekend.